Okay, I do have a question from Elizabeth. Good question. How do we get complete care from multiple doctors? It seems very difficult to get specialists to communicate with each other.
Well, Liz, that is the question of all questions. And I think that when we think about sarcoid, my opening line to anyone is that sarcoid is not just a disease of the lung. It affects every single organ in the body. And if you were a med student, Liz, I would say, you tell me the organ and I'll tell you what exactly could happen to it. Eyes, uveitis, the brain, CNS sarcoid, the heart, myocarditis, pericarditis. So when we talk about sarcoid, it just so happens that pulmonologists like me, most of the time, will be the quarterback because the most common organ that affects a sarcoid patient is the lungs. But you got to be good in like internal medicine. You got to be good in family practice, and you got to be a good communicator, because you already answered your question, which is the hardest part about healthcare is talking to other doctors, talking to other healthcare professionals, because communication's got to be great. And I think it's tough when I have a patient that sees me here at USC, but then they have their kidney doctor, a nephrologist at a different hospital, and then they get their eye examined at a different hospital. And I'm waiting for these notes and those labs to come to me so I could be a kind of a good quarterback. So my advice is, as much as possible, is to kind of consolidate your care in one place. I think that you got to pick a provider and doctors that actually like each other, that like to communicate, that are not overwhelmed, because it is overwhelming right now in the healthcare system. COVID, all these things, all my staff is out because they're all in some kind of quarantine right now. So it's hard to communicate. But I always would say that I encourage my patients to be their own advocates at all time. And I'm sure some of the patients could relate to me, where you come see a doctor for sarcoid, you just assume that the doctor doesn't know what sarcoid is. And you bring this like Webster's dictionary of your notes, like, hey, and here are my notes, and sometimes it's overwhelming. I'm like, oh my God, but I think that you have to keep track of your studies, your tests, your questions. And what really impresses me, and I do have a couple of patients like this, is where when they want to transfer their care to me, they have like a nice summary list. And some of my patients have had sarcoid for 30, 40 years, and they're so nice to me. They know that I'm not going to flip through every page because it's just life. But they'll give me the highlights list about what are some big things, what organs are involved, what was the last note with the doctor. So I think you have to kind of be kind of a doctor yourself. So my advice is simple. I think if you consolidate care, that's going to be great to have everything in the same place. Sometimes being an okay doctor isn't how smart you are. It's just, are you willing to talk and go the extra mile to communicate and be your own advocate, take some notes, and just kind of know, kind of your summary, kind of your elevator pitch when you meet your new doctor of where you are now with your sarcoid. So awesome question. And I hope that helped out.